As the nation's largest physician-owned medical malpractice insurer, the Doctors Company has an unparalleled understanding of liability claims against anesthesia professionals. We reviewed more than 600 anesthesia claims that closed from 2007 to 2012 to learn more about events that place anesthesia professionals at risk. We have invited Dr. Randolph Steadman, a member of the Doctors Company Anesthesia Advisory Board and editor-in-chief of the American Society of Anesthesiologists Editorial Board for simulation-based training, to present our findings.
As an anesthesiologist and advisor to the Doctors Company, it is reassuring to know that they take the time to understand the risks that are specific to the anesthesia profession. The results from this study reveal the underlying vulnerabilities in the practice of anesthesia. The top 3 most common allegations in anesthesia claims include: 1. Improper performance of procedures. 2. Tooth damage related to intubation or extubation. 3. Improper management of the patient under anesthesia. The most common allegation in anesthesia claims was improper performance of anesthesia procedures, which accounted for 25% of the claims. And the 5 most common procedures associated with this allegation were: 1. Injection of anesthesia into the spinal canal. 2. Intubation of the respiratory tract. 3. Injection of anesthesia into a peripheral nerve. 4. Injection of anesthesia into a sympathetic nerve. 5. Nasopharyngeal intubation. The second most common allegation was tooth damage related to intubation or extubation, which accounted for 24% of the claims. The third most common allegation, which accounted for 19% of the claims, was improper management of the patient while under anesthesia, which is related to decisions made by anesthesia professionals while patients were under anesthesia. Examples of this allegation include inadequate monitoring of vital signs, delayed response to obstructed ventilation or esophageal intubation, delayed response to deteriorating vital signs, inadequate response to hemorrhage and respiratory or cardiac arrests. The top 3 allegations we just discussed account for 68% of anesthesia claims. The safety of anesthesia care has significantly improved over the years. However, the Doctors Company found that patients still suffer injuries related to the administration of anesthesia. 44% of patient injuries were attributed to technical performance, which identifies this as the most frequent cause of harm. Technical performance included known injuries, poor technique, inappropriate method of administering a drug, and incorrect body positioning. Inadequate patient assessment was the next most common factor that contributed to patient injury. This includes inadequate history and physical for patients with conditions that increase the risk of complications. The third most common factor associated with patient injury was lack of documentation. Documentation was missing for clinical findings such as low blood pressure and oxygen saturation. Experts also noted inadequate review of care in situations such as resuscitation attempts. A common theme in this study was inadequate preparation for complications. In a few of these cases, rescue was delayed because equipment for emergency tracheostomies or cricothyroidotomies was not readily available. Extubation resulted in harm if too much medication was given close to the time of extubation. Some of these patients suffered anoxic brain damage due to sleep apnea, overdose of opiates, or drug reactions. The results of this study are consistent with the American Society of Anesthesiologists Closed Claims Project.
The result of the study revealed risks to patients and exposures for anesthesiologists and CRNAs. The goal of this study is to alert anesthesia providers to risks that can be addressed to help prevent patient harm. To view the complete study, please visit www.thedoctors.com.